Hi everyone, welcome and let's explore brachial plexus. So literally brachial plexus means arm or upper limb, and plexus means a nerve network. So it's a nerve network that supplies the upper limb. And generally, plexus are formed by the ventral rami of spinal nerves. And there are four main plexuses in our body. We have cervical plexus, we have brachial plexus, we have lumbar, and we have sacral plexus. So brachial plexus is the most complex plexus. It has parts, it has roots, trunks, divisions, and cords. So due to that, it's the most complex plexus. So brachial plexus, it has roots, it has trunks, it has divisions, it has cords, and it has branches. In case if you need a mnemonic to remember these parts, really trusty, drink cold beer or drink coffee. So it has roots, trunks, divisions, cords, and branches. So let's start with the roots. So the roots are formed by C5, C6, C7, C8, and T1. So brachial plexus has contributions from C5 up to T1. So the roots, they join to form trunks. So C5 and C6 root, they join to form superior or upper trunk. C7, it forms middle trunk. C8 and T1, they join to form lower or inferior trunk. Again, the trunks, each trunk will give anterior and posterior divisions. So superior trunk gives anterior and posterior divisions. Middle also gives anterior and posterior divisions. And inferior also gives anterior and posterior divisions. Again, the divisions, they join to form cords. So the anterior division from superior and middle trunk, they join to form lateral cord. All the posterior divisions, they will join and they will form posterior cord. And the remaining anterior division of the inferior trunk, it will form medial cord. And the cords will give terminal branches. So lateral cord, it gives musculocutaneous nerve and half of median nerve. Posterior cord, it gives axillary nerve and radial nerve. And medial cord, it gives ulnar nerve and part of median nerve. So median nerve has contributions both from lateral cord and medial cord. So when we see musculocutaneous nerve, median, and ulnar nerve, they will make capital M. So you can use this capital M in cadavers or in models to identify these three nerves: musculocutaneous, median, and ulnar. But brachial plexus has supraclavicular branches. So brachial plexus, it begins in the neck and it descends down to the axilla and it gives its terminal branches. But before it crosses the clavicle, it gives some branches. So it gives dorsal scapular nerve, suprascapular nerve, long thoracic nerve, and nerve to subclavius. So before it enters into the axilla or above the clavicle, it gives four branches: dorsal scapular, suprascapular, long thoracic nerve, and nerve to subclavius. In addition, it gives unnamed branches. It gives many unnamed branches that supply muscles, but the named ones are these four nerves. So these four nerves, they arise from the roots and trunks. And when we see the infraclavicular branches, in addition to the terminal branches, brachial plexus has side branches. So when we see the lateral cord, it gives three branches: two terminal branches and one side branch. So it gives a lateral pectoral nerve, musculocutaneous nerve, and part of median nerve. So musculocutaneous and median, they are terminal branches, but lateral pectoral, it's a side branch from the lateral cord. And there are 5 branches from the medial cord. So we have medial pectoral nerve, we have medial cutaneous nerve of the arm, we have median cutaneous nerve of the forearm. These cutaneous nerves are sensory nerves, they supply skin. And we have ulnar and part of median nerve. So medial cord has 5 branches, 3 side branches and 2 terminal branches. Similarly, posterior cord has also 5 branches. So we have upper subscapular nerve, thoracodorsal nerve, and lower subscapular nerve. These are side branches. And the terminal branches are axillary and radial nerve. So radial nerve, as you see, it's the largest nerve. It has contributions from all the roots. So it's the largest in its size. So that's all about the brachial plexus.